Kelly, and we have a lot of our folks on. We're always happy to talk to a number of issues. America's Heroes Group Roundtable on public policy. And we're going to start off with our good friend, Dr. Damon Arnold. Doc, how are you? Dr. Arnold, are you there?
Yeah.
Yeah, I hear
think
you
we
now.
got bumped.
Huh?
This is Ernesto. I'm on.
Okay, Ernesto.
Rochelle.
Rochelle's on.
And
Sean
Damon.
Claiborne.
Yeah, Sean's on. And
Doc Arnold.
Dr.
Yeah.
Okay, everybody's there. That's what I
Okay.
want to know.
All right. Okay.
That's what I want to know. Doc, I want to start off with you because we had a CNN audio that we wanted to the article. Okay, article in the Washington Times. Wants you to respond to the fact that the virus cases have nearly tripled in a week. What's your professional opinion on that?
Okay, the Washington Times article, they had one on April 2nd, and it was about the military coronavirus cases nearly tripling in a week. And what they were saying is that the virus, which is COVID-19, there's a virus called SARS-CoV-2 that causes the coronavirus disease. And they were saying there's a total number of cases that increased from 652 to 1,638 cases in less than a week, so almost 3 days. So the doubling time really accelerated. And they said that also it wasn't just, the service members themselves, but also contractors, people who were in civil service employees, and then also some of the family members of some of the service members as well. So it looks like it was really accelerating, and this forced the Department of Defense to have some kind of reaction to it. And I think it's understandable. There's a understandable balancing point that the military has to contend with. For everyone that has served in the military, they would understand this, between military readiness for national defense and that of force protection from the coronavirus. So we have to protect our military personnel, but we also have to be ready to respond to any given moment to a military threat that poses itself to our country. And it's undoubtedly led to a statement made by the Defense Secretary, Mark Esper, from the Pentagon, and he said that he was insisting that the armed forces find a way to both protect troops from the rampaging virus while still performing the military's essential operations. And I think this is really important. The phrase "preserving the force" is military parlance for keeping a military that is fit, which means that it's well rehearsed, ready to deploy. So those run counter to our social distancing right now that the medical professionals are saying is required and must be in place. And so in order to beat this novel coronavirus. So we are now at a HEPCON, which is a acronym used by the military. So it's a public health emergency management within the Department of Defense actually has this acronym that's health protection condition. And so we have different levels. We have 5 levels going from 0 to Alpha, Bravo, Charlie, and Delta. And Delta is when it's severe and widespread, and you have person-to-person transmission occurring. So they are actually pushing us. At that point, they were saying Charlie. Now it's moved to Delta, where they're trying to keep people stay at home and making sure that we protect the reactionary forces, the acute reactionary forces.
Let me ask you one other question while we have enough time. There was a CNN audio where a staff sergeant, Wesley Black, diagnosed with colon cancer because of burn pits from Iraq and Afghanistan.
Yes.
Yeah. What about that? Oh, we're gonna. I'm
it
sorry.
was,
I'm sorry.
Absolutely
Hold
astounding.
on a minute.
Just,
Hold on a minute. I'm sorry.
Yes, going to play.
Yeah, we're gonna play it. Yeah, CNN.
We're talking about the health problems that veterans and active duty service members have begun to exhibit because of their exposure to burn pits. These are giant burning trash piles. They're sometimes acres in size that the military used to burn waste in Iraq and Afghanistan. These were the answer to how do you dispose of trash in a war zone when you can't just run down to the local landfill. There was a new survey by the Iraq and Afghanistan Veterans of America that has found nearly 90% of post 9/11 veterans were exposed to burn pits. And of those exposed, 9 in 10 said that their health issues could be related. Joining me now is Iraq and Afghanistan Veterans of America CEO and former Navy officer Jeremy Butler, whose organization launched this survey. And we also have retired Staff Sergeant Wesley Black. He is a veteran of the wars in Iraq and Afghanistan. He has incurable stage 4 colon cancer due to burn pit exposure. And Wesley, we tell your full story. It's an unacceptable story. It is also a story of just how much you have given, and we tell this story at cnn.com/homefront. We describe what goes into these burn pits, which is pretty much everything. You told us this: human waste, medical waste, plastic, rubber, food, big screen TVs, beat up Humvees. Tell us, after these massive piles of trash are doused in diesel and jet fuel, which are known carcinogens, and set on fire, tell us what your experience was like, how close you were to these, and what it was like to breathe this air.
Well, thank you very much for having me on.
Of course.
So the biggest issue that it comes across as is these burn pits. If you imagine just a football-sized field of burning trash, and it's pouring out hundreds of cubic liter volume of toxic smoke, and it looks just like a giant burning field. It irritates your throat, it irritates your eyes, it gives you respiratory problems, and unfortunately for me, it led to some more serious health complications. So,
yeah, that's right. You were diagnosed with colon cancer that had spread to your liver and lungs. You were told you had 3 to 5 years to live, and that was over 3 years ago. You have a wife.
Yes, ma'am.
You have a small son. Tell us what
ma'am.
it's been like dealing with this, and also the fact that you think you didn't get care that could have saved your life.
Yeah, so it's been rough. My wife is my hero. She's had to take on quite a bit. And my son is 3. He's going to be 4 in a couple weeks, and it's at the point now where thankfully he doesn't understand what's going on, but it's only a matter of time before he finally realizes that something's wrong. He knows that Daddy goes to the hospital all the time, but my family has had to sacrifice so much now. I left the combat zone 10 years ago.
That's something. Well, we wish you well, that's for sure. Dr. Arnold, what do you think about that?
First of all, I want to extend my sympathy and my every service member is like a family member to me, and to see Staff Sergeant Wesley Black go through that is just absolutely a horror to me. And one of the things that was mentioned, is that approximately 90% of the people who are in Afghanistan and Iraq were exposed to these burn pits. And I know as personally I was myself, and I always used to make comments about it because it was something that would cause some irritation. And there was actually a case that came up, and it was in February of 2018, where a federal judge of the U.S. Department of Labor ruled that an exposure to open-air burn pits was actually linked to a service member's lung cancer. And it was not adopted by the Department of Defense or the VA, but there was metal and rubber and chemicals and other wastes that were actually involved with that were known to be carcinogens, cause cancer-causing chemicals and toxins that people were exposed to. And when you are exposed to it, you can actually develop things. It's linked to things like asthma, chronic bronchitis, coughing that doesn't, go away, and difficulty with breathing, headaches and migraines, heart conditions, leukemia, lung cancer. I mean, you can go on and on, gastrointestinal issues as well. And we're seeing, higher rates of cancer in those members who are returning from that theater. And similar to, in fact, they actually approved it for our Vietnam veteran members with respect to Agent Orange. But I'm hoping that we actually have a quicker turnaround time on this issue, and that people are actually taken seriously when they come back and start talking about these complaints. Because many times the people who are listening to them, there is no specific test for it, but you should be listening to the history and making sure you document things appropriately if you are a VA physician.
Absolutely.
And you are actually examining someone. It's a disservice to our service members not to.
Thank you so much, Doc. This is, I tell you, it gets worse and worse. Listen, here's an audio, CNN audio.
Now that's how you send out one of the greatest captains you ever had. The GOAT, the man for the people.
To me, that demonstrated extremely poor judgment in the middle of a crisis, because what it's done, it's created a firestorm.
This is a situation where a Navy captain was removed after warning the people on his ship about this problem with the poison, the virus. Ernesto?
Yes, I'm here, Cliff.
Yeah, what do you think about that?
Well, I think that the captain, Brett Crozier was his name, and is his name, and I think certainly he is a hero for what he did. And you're on an aircraft carrier that carries, I think his ship, the USS, and this came from Newsweek and CNN, carried nearly 5,000 soldiers.
Sure.
Sailors, excuse me.
Sailors.
Men and women, sailors.
And pilots and everybody else, yeah.
Yeah, and everybody else, pilots. Because, on that ship, you've got, and especially the guys who, the enlisted people, they live in cramped quarters. They've got 3 bunks, like racks, they call them. And 3 to a rack. And they're in very tight quarters. And, last week he had 3 sailors who had tested positive for for COVID-19. Then 2 days later, he had 25. On this past Tuesday, he had 70. Then Thursday, he had 100. So he's reaching out to the Navy, Department of Navy, and his admirals and people above his rank. And I guess nothing was being done. And so he's communicating. He's going through the lines of proper lines of communication, but I don't know whether he put it out there or somebody put it out there, and it ended up his hometown newspaper, the San Francisco Chronicle, and the Navy, and then he's relieved by this Admiral Stuart Baker, who then, of course, reports to the acting Secretary of the Navy, and Modley, who is the acting Secretary, and then, of course, Esper's over him. But then they claim that the White House, they got no direction from the White House to relieve him of duty, and that it was simply the admiral that did this. But why wouldn't the White House know that you have a nuclear aircraft carrier? It has planes on it, all kind of jet planes. You've got a nuclear reactor on the plane, on the ship. You've got all kinds. You've got personnel, almost 5,000 personnel, and nobody was doing anything. So, the sailors feel like the captain had their back, and I think he's a hero. And even Teddy Roosevelt's ship is USS Theodore Roosevelt. Teddy Roosevelt's great-great-grandson called Captain Crozier a hero for what he did. So I think that I hope people remember things like this. How you can turn your back on people who are in cramped quarters, and we know just breathing alone will spread the virus. Not you mentioned coughing and singing or talking loud, and it's ridiculous that nothing was done. Luckily, 1,000 of them they shipped. The ship is now in Guam, and they let 1,000 off immediately. They're going to try to let some other sailors off, and I understand some of the sailors who have tested positive are in hotel rooms and maybe hospitals. But this is a shame because that could have spread so quickly on a nuclear aircraft.
Yeah.
So the captain's a hero.
I agree with you.
One quick thing about that. With Ernesto saying, it's like, Theodore Roosevelt used to say, speak softly but carry a big stick.
Yeah.
Right.
This guy
That's
spoke
right.
loudly and carried a big stick.
Yeah. That's exactly right.
And they are very appreciative of it, and
I'm sure they
how this could not be. He's getting no response from the chain of command, and he had to put it out there to save lives. And undoubtedly,
he did the right thing.
He probably
too,
saved hundreds of lives.
I agree with you. Yeah.
So he's a hero.
We'll go to Reveal News, and Trump says he's protecting veterans. VA workers says they're forced to work without safety precautions. Rochelle, what do you think about that?
I'm present and accounted for, sir. Thank you so much.
Thank
and
you.
You know what? I'm glad about that sailor using common sense. That's all I'm going to say, and I'll leave it right there.
Right.
But, with Reveal from the Center for Investigative Reporting of March the 23rd, the workers are saying that they're really not receiving the support that they need. They're forced to work without safety precautions, too. And they're working around a lot of veterans who are, elderly. They're 90 years and older. The VA has got more than, 170 hospitals with 9 million patients across the states, and they're not being tested either, they're saying. They're being forced to work pretty much untested and being told that, if they don't have symptoms, that they should really just keep working, was what it boils down to. Now, keeping in mind that the VA was already reportedly 44,000 understaffed from the frontline health care. And when you talk about protection and being able to have masks and gloves and the things that they're needed, the health workers don't have to lie about they're not getting that support. They're not getting those supplies for them. It has to have some truth to it. Of course, a lot of them are, dealing with at-home issues too, so they have to come and work under those conditions that are not, really talked about a lot of times too. They had 204 cases, and the staff, they were not actually tested during that era either. That time from when they were counting these cases, they're not getting what they need. And it's shameful. We should be ashamed as America that, with all the things that we have going on, you're looking at the different facilities from New Orleans with the highest cases, 65 cases, 20 in quarantine, and then you have 44, inpatient ones that have been affected by this virus, and they're short with gloves and masks, and, they need protection. And what they've been told is that we'll get you the stuff, and I guess that's supposed to mean they're going to eventually get what they need. And I do know, like in Chicago, at that Halsted Care Center at 77th and Halsted, they're screening appointments for the VA. They're in a proximity that is not distanced out among the employees there. Those employees are not tested when they come in, but they're testing employees, and even though they're not the medical care, they still are a part of the VA, and they should still have those same protective categories set up for them. And if it's in Chicago, you hear that it's in Wisconsin also, that, the clinics are not getting what they need. They don't get masks. One of them said that she didn't get masks until a half hour or an hour after her shift, and already she's been testing patients doing her duty, when they come into the hospital. Some employees reported that they, were getting the symptoms, and they're actually exposing other, patients there. So, I don't think that we're doing what we should do, from the White House perspective. He says a lot of things, but that secretary also needs to be a part of that administration that is reporting back, because veterans have a large population of patients, and, we don't hear about that. It's been small bits and pieces where we're hearing about the veterans. So we need to do better by our veterans. They deserve it. They earned it, you know, and this is always that case where we take 2 steps forward and now we take 9 back. So, you know, we need to pray about that and keep our men and women, you know, in our prayers that are having to deal with the VA. And we have to thank those, too, that are standing on that line, that are doing what they need to do and compromising their own health and their families by going to their jobs everywhere. The least we can do is make sure that they have all those things that will protect them.
Rochelle, good point. Thank you so much. Appreciate that comment. We also now want to mention ABC Channel 7 News, an audio, ABC 7.
Guard officials decided to open this testing facility, and they opened it this morning. The I-team was on hand when the first of the first responders arrived to be swabbed. Police, fire, paramedics, and healthcare workers started lining up for drive-through coronavirus tests. The operation run by more than 100 newly activated Guard members, many seen in uniform here. The perimeter carefully controlled by Chicago police, and only certified, credentialed first responders were being allowed in. No family members, according to authorities. About 250 tests per day.
Now, these are our professional doctors, our nurses, our medical professionals that are supported by logistics. Folks that are there to manage that line and to help, you know, our neighbors, our community, folks in our community to get through and be tested. Today they started out with the first responders.
Test givers in personal protective gear visible at work inside this unmarked and repurposed warehouse facility, taking swab samples from first responders. There is a premium on getting first responder tests back quickly and achieving a faster turnaround time on all COVID testing, according to Weiss Memorial Hospital internist Dr. Eric Mizuno, who talked with the I-team this afternoon.
The sooner we know what's going on with you, the sooner the patient can know that I'm fine and I don't need to worry about it, or we have something to deal with. I know what to tell the patient. And so these PCR machines, they should typically run samples within 3 hours.
Eventually, that National Guard testing facility will transition from first responders to the public, but there is real pent-up demand in the first responder community for these tests, so it's unclear how long they will actually be doing just that before they can transition to the public. The first responder test ran out for the day at 2 o'clock this afternoon, and the arriving first responders still in line were told to come back tomorrow.
Thank you. All right. Let's go to Brother Hall. Brother Hall?
Hello.
Hi. Go right ahead. You're on.
Hey, Cliff, and to your guest.
Yes.
Yeah, right. My concern, Cliff, is the brothers and sisters that's up under the buttocks that are veterans. I know of some because, as you know, I feed. I'm not feeding now because, you know, I don't want to put myself in a situation, but I know for a fact, and I never thought I'd see the day that it would be discrimination against the homeless. You know, now, I give the governor and the mayor praises for the efforts, but, you know, if they come out and see for themselves, they would see it, particularly up on the 51st in Wentworth, Archer, and Stewart, right off the expressway of Halstead and maybe about 19th. You know, so I heard them say that they were getting the homeless off the street, and I just don't see it not on the south end. So, and there's a lot of veterans out there that have paid their dues to protect us.
You're right.
And to serve.
Yeah.
To me, like you say, all politics are local.
Yep.
This is local as well.
Thank you so much.
I'm more concerned about our local elected officials addressing this issue, and particularly with the social distance.
Appreciate
we got
it.
people on Channel 5 are saying the mask doesn't mean anything. You know, now people are telling us we need to mask up or stay in the house. Can anybody clear that up? You know?
Yeah, I got you. Let's before we run out of time, let's go to Sean. Sean, hi.
Right, to answer Brother Hall's question, the main thing that the Department of Defense and also for the health officials are saying that when you wear a mask, that is helping you protect other people primarily. Dr. Arnold even mentioned before in our show, the mask itself, the N95 mask, is not going to do a lot to protect you personally from the particles from the virus itself. But if you are sneezing or coughing, you can trap some of that projectiles, that germs from coming out from your mouth. That's the most important thing. I also wanted to comment on what we talked about with the National Guard. One thing people need to understand is that there's a lot of rumors, and even the Department of Defense have addressed this issue, that this is not an attempt to start martial law. This is not a federalization of the National Guard. The National Guard is there to serve and protect and also assist. They're not a primary first responder. They're more like a secondary responder. So as guardsmen, what we do is we go in and we support the local establishments to help get the materials, and we do everything from helping to build the hospital. For example, we converted the McCormick Center into a medical facility that can take 3,000 beds, or we can just sweep up and clean up the mess or the trash from the leftover debris that's left over from this operation. That's what the Guard is primarily designed to do.
Okay. Sean, thank you so much. And the rest of our great panel who got out a lot of great information. We appreciate that. This is, of course, America's Heroes Group.